The Defence Secretary Ben Wallace is on the line. Good morning, Mr. Wallace,
Good morning.
and happier New Year to you, I think, as we're now saying.
I think let's just get past 2020 and into 2021. I think that'll be hopefully the better year for us all.
Indeed. We want to talk to you about the armed forces, but look, let me first put this to you. The intensive care doctor at UCL, Professor Hugh Montgomery, has told Times Radio this morning that we can't blame the government for the appalling surge in cases at the moment. We can't blame the tiering system. We can't blame testing. This is people behaving badly, he says. I'm just very angry about this. If we were wearing masks, washing hands, using gel, we would not be in this mess. Do you agree with him?
Well, I think all the way through this, the government has said quite clearly, as have the medical professionals and the scientists, that individual responsibility, taking individual steps, face, hand, space, all those different approaches, keeping 2 meters apart, etc., is a really, really important step to slowing down and preventing the spread. I think that's really important, and sticking to the rules of each tier. Look, I myself made a mistake earlier in the year where I shook hands with someone and I had to apologise, and that's quite right. We should make sure that we take care in what we do, because in the end it is people that spread this awful disease, and this new variant, which I think is over 50% more virulent, is even more worrying for us. And you only have to look at the capacity issues the NHS is now facing to realise that we are so close to getting towards the vaccine rollout that we shouldn't ruin it now.
Well, of course, it's people, not governments, who spread the virus. But it does rather beg the question, does it not? Why are you not doing more on enforcement? Come down to Borough Market if you're in town anytime soon. I'll take you for a look around it. The place is rammed with people going to Christmas markets in long queues, no social distancing. Why are you not clearing these sorts of places out with troops if you have to?
Right. The armed forces are not out there on the street going to be doing that type of enforcement. We have civilian authorities, police, others to be able to do that. And look, of course,
But they're not. They're not there.
Well, I'm not in Borough Market because I'm up in Lancashire. So what I would say is that you heard, I listened to your excellent interview with Professor Montgomery. I mean, you can't have it clearer than that, which is people need to take that responsibility. And of course, our police should be and are already dealing with enforcement of those issues. But we shouldn't be deploying the army to go around pushing people around in that way. Our armed forces are there to support and help the civilian authorities. They have those powers. We are always willing and able to backfill the civilian authorities so that they can put more people on the front line. That's what me and the Home Secretary often do, actually, and regularly plan how to do that. You often see that in, for example, op tempora and counter-terrorism, where we backfill armed police in other parts of the country to allow more police on the street. There's lots of different ways of doing it, but it is really, really important. And I think, to be fair to the government, that's why we took the view of bringing in the tier fours before New Year's Eve, rather than, the easy thing to have done could have been just to say, well, let everyone have a New Year's Eve and then do it on the 1st of January. But that's why it came in earlier. And I think that's really important.
OK, let's turn to what the armed forces are up to then in this pandemic. How many troops have you committed at the moment to COVID support? The number must be increasing quite rapidly.
Yeah, I mean, it goes up and down. Right now, we've got about 5,000 people committed personnel on COVID tasks. We've 67 MACA requests are open, as in are being used, and so far in 2020 we've done 473 MACAs. So I just authorised last night 130 military planners and personnel to go to the NHS vaccine task force, effectively to help them with making sure that we ramp up delivery of vaccine in parallel with the stocks as they come online. And I've already got ahead of that curve by also asking officials and senior military planners a few weeks ago to plan to maximise that when the call comes. So we're in the place to be able to deliver much more vaccines, especially in hard to reach areas. Remember, the strength and the versatility of the armed forces is being able to get all over the United Kingdom, and we'll be able to do that as well.
Well, I did want to ask you about that specifically. We know, don't we, that the NHS is under extreme pressure. They don't have huge amounts of spare staff to administer the vaccine. You perhaps do. You have thousands of medically trained personnel at your disposal potentially. Have you, or will you make them available to deliver these vaccines, to put needles in people's arms? And if so, what sort of speed could they do this?
Well, I've already done that planning. Yes, for example, we've already put 133 in and will continue to into the overall vaccine task force. But I've also got plans for up to 250 teams of mobile medically trained personnel who could go out and administer the vaccine around the country. That would be over 100,000 a day they could potentially deliver if that is requested by the NHS.
Over 100,000 a day.
Yeah.
So that's
and we're planning to even continue to be able to grow that if possible.
so that's what 700, 750,000 a week.
Yes, we could do that. That we have combat medics. I think the thing that what people need to understand is that a lot of our clinicians in the armed forces are also clinicians in the NHS. So they are often reserves, military reservists. And so it's not quite as easy as just taking a whole load of people who, let's say, might be a anaesthetist in the armed forces and just putting them in the NHS. You'll probably find they're already working in the NHS as a reserve. But on combat medics, that's we've trained quite a lot of people to be combat medics and support in sort of obviously in frontline units, etc. They can deliver injections, and those are the people we'd make available to increase delivery of this vaccine as the vaccine stocks come online.
Well, that's very interesting. Thank you for telling us. I'm not sure we were aware of that. Tell me, though, that the government's target is 1 million vaccinations a week at the moment. Obviously, there are hopes that that will grow. With your, I think it was 250 teams of combat medics, 750,000 vaccinations a week alone that they will be able to carry out. How much more can you increase that target of 1 million? What could it go up to? 1.5 million, 2 million?
Well, you carried the interview by Nadeem Zawi, my colleague, the minister in charge, and the challenge at the moment is simply not the NHS and its structures. They have an army of volunteers that they've been recruiting. They also have a plan to deliver. Currently, the challenge is making sure that the stock comes online in time. And AstraZeneca Chief Executive Pascal Soriot said yesterday quite clearly that he's starting to ramp up that manufacturing process in the first and second week of January. And we'll get up to, he says he'll start next week and get to 1 million a week beyond that very rapidly. So I think we're going to start seeing the manufacturing ramp up at the same time. And I think that's the skill of the NHS planners and the military planners hopefully will help support, is making sure we do that in lockstep with the supply.
But what you're telling us this morning is that you have the personnel ready. If AstraZeneca can get you 1 million, 2 million vaccinations a week, they said they could by the end of January, you can administer 2 million vaccinations a week with the help of the armed forces.
Well, yeah, I mean, look, it may be that the NHS doesn't require our support to increase that delivery. I mean, they have been out recruiting volunteers and people who can deliver the injections. I think what we always say, and this is right across the board of the government response, is a bit like the enforcement issues. We stand ready to do that, but it is, of course, correct in our constitution that the civilian authorities make the request. We don't impose military mass and military personnel on people. If local authorities come to us, if hospitals come via the NHS or regional NHS to us, or anybody else, and we find our armed forces assisting across the whole gambit of government, then of course we respond, and we are always open to delivering that. And we have seen that. We've seen over 10,000, 11,000 people throughout this process, constantly helping the United Kingdom get through this COVID event.
Well, let's turn to another area the military are assisting, and that is, of course, testing in schools. Now, schools are closed for next week, secondary schools and primary schools in some areas, the Education Secretary said yesterday, because there hasn't been enough time to set up lateral testing systems. So the question for you is, of course, why wasn't the military help given earlier to do this? You have 1,500 troops trying to help with this. This we knew was coming, didn't we? We knew there was a second wave on its way. Why has it been left till January?
Well, it's not been left to January. Over the Christmas period, of course, getting into the schools, which obviously were shut to start that, and rolling out the staff training, it is something that we had to deal with, and was is not as straightforward as when the schools are open, obviously. So I think from the 4th of January, that's when staff expect to go back, and that is when the best time is to start the process. We as the military can provide both sort of guidance remotely, or indeed we stand ready in the regions to actually send personnel to support the teachers and staff in how to administer the lateral flow test. Also, there is a role of the regulator here, the MHRA. I went down to see the lateral flows being administered in Liverpool, and there were lots of lessons to be learned from that. And then how they get self-administered, or how some of those flow tests may even be posted to other key vulnerable groups of people. All of that requires a sort of regulation framework.
Okay.
So all of that has to go on in tandem. But look, I'm confident that the military are there to help people get back to school. We stand ready to do that. I've devolved those authorities down to the regions in England and Wales, so that those regions can actually have some relationship with the schools to allow the help to go where it's needed.
Okay, and finally, there is, of course, still concern about why the Nightingale surge hospitals haven't reopened yet. Some moves ahead, but as we discussed, the NHS is suffering from staffing problems at this time of year, of course, because of COVID. You have medical regiments. Perhaps you could staff those Nightingales yourselves with your medically trained military personnel.
Yeah, look. First of all, I think it's been wrong to characterise all these Nightingales as sort of locked up or dismantled. A lot of them have been on and off being used, maybe albeit at small numbers, but they were designed also at a time when, if you remember, it was all about the ventilation, and they were designed for effectively to administer ventilation to patients who came in already stabilized to be ventilated and then leave. They weren't necessarily designed like a district general hospital. And so what the NHS has been doing, quite rightly, is expanding existing general hospitals to increase their capacity within a hospital, because the health secretary was quite right when he said yesterday the best place if you're going to fall ill in a hospital is in a district general hospital with all the other support around it. So I think that's been the first point of call. But of course, we stand ready to help with Nightingales if the critical pressures go beyond the capacity of the existing NHS. We are on, I think there are 17,000 ventilator beds currently being used of a capacity of 21,000. So, if it starts to tip over there, then of course you'll see those Nightingales being more active.
Yeah.
And yes, we have a number of medical staff, but as I said earlier, at least two of those medical regiments are reserve regiments.